Well, Pat and I thought it was very important to make a donation to Cedar Valley Hospice. And I think of really a couple big reasons why. We donate because we want to make sure it's going to make a difference for people in Cedar Valley Hospice. And I think if it makes a difference for one patient and one family, it will have been a successful donation. And I know it will, and I follow that up with the fact that I've had a lot of experience with Cedar Valley Hospice, that I know those donations will help. A lot of people don't know my history with Cedar Valley Hospice. They were formed in 1979, and that was about the time I came here to practice internal medicine. The first patients that were admitted to Cedar Valley Hospice were in 1980. And from 1980 till about 2020, I admitted a lot of patients to Cedar Valley Hospice. And I saw the work that they did for my patients and families. It was absolutely wonderful. They did so much work for me. I saw the work that the nurses, the social workers, the spiritual counselors did. And I was totally amazed at what they did and the work that helped patients and families, and it also helped me as a physician. And I learned so much from them. And then it was a number of years ago when I retired, I became the first medical director for Cedar Valley Hospice. And in that position, I suddenly realized how much work and what everybody did that I hadn't seen as a referring physician to Cedar Valley Hospice. And I was totally amazed at how dedicated these people who worked in Cedar Valley Hospice, anywhere from our financial people to the techs, to our volunteers, to our nurses, our social workers, our music therapists, the work they did, how dedicated they were, and what a passion they had for it, that it made such a difference. And I learned so much from them, it became more of a passion for me. And then, as a lot of people don't know, I developed an illness. I was quite sick, and actually I was given a short time to live, and I was a patient in Cedar Valley Hospice. And as a patient, I knew from what I'd seen, referring and as a physician, that they had the needs that I needed and my family needed. And those experiences were absolutely wonderful. There are still some of the nurses who are working in Cedar Valley Hospice who were my nurses at that time. And in a sense, my donation too is a thank you to what they did for me and my family. And then, as I got better, and I actually graduated from the program and went back to being an assistant medical director because I had such a passion for it. I just could not leave, that I knew any kind of donation I could give would make a difference in a lot of people's lives, and a difference actually in the people who work here in Cedar Valley Hospice, to make it easier and more pleasant. Giving that donation we gave, I know is going to make a difference in people's lives and families. And knowing that Cedar Valley Hospice makes every day count, and it does make a difference to help families and patients cope with that end of life and help them handle it better, so much better than if they hadn't. And also donating to Cedar Valley Hospice, I've had experiences with hospices in many other parts of the country through other relatives of mine, and I have not seen any other hospice program as dedicated and as passionate, who does the type of care for their patients as families as Cedar Valley Hospice does. And because of that, I know that my donation, I want to keep that program going forever because it's such a wonderful program.